The number of Americans dying from drug overdoses has gone up for the 11th year in a row. Most of those deaths are accidental overdoses from prescription drugs, not illegal ones. A new report from the CDC says more than 38,000 people died from drug overdoses in 2010. Prescription drugs were involved in about 60% of those cases. Joining us this morning is Dr. Devi Assistant Professor of Anesthesiology and Rehabilitation at the NYU School of Medicine. Thanks for joining us this morning.
Thank you for having me.
So tell me, were you surprised when you heard about this report?
Well, the report is alarming, but it's actually not that surprising. It's the 11th year, as you said, so this is a problem that's been going on for a while that just seems to be escalating.
Yeah, and it's prescription painkillers that seem to be the problem. Why are people accidentally overdosing on prescription painkillers?
I think there's a few factors. So first of all, people think that because it's prescription that somehow makes it safer than other illegal medications. So that's one misconception. The second thing is we use it to treat pain. So some of the unintentional overdoses are because people have pain, they take the medication, but their pain doesn't necessarily go away or get as much better as they hoped it would. And so they take more of the medication, or they may take it differently than it's prescribed. And ultimately that can lead to an overdose.
Do you think that people are aware of how addictive these painkillers can be? I mean, it's one thing to take it because you think you're feeling pain, and so that makes sense, but there's another component here. People can get addicted.
That's true. I think there are two different groups. So some of these overdoses are people who are really not addicted, but they just don't understand the side effects or the dangers of the drug. So that's one category. Other people may be addicted, but they may not even realize that they are because they think they're taking the medication for their pain. So it's kind of a blurry area where a person may have both. They might have chronic pain and suffer from an addictive disorder.
So then what do doctors and patients have to do to avoid an accidental overdose?
The most important thing is for them to communicate with each other. So it's important not just for the healthcare provider, but also for the patient to understand all the risks and benefits of the drug. So in some cases, patients will have this medication, they'll take more than what's prescribed, or other times they may think, oh, my friend or my spouse has severe pain, and maybe they don't have access to these types of pain medications. You know, maybe they don't have health insurance, they don't have a doctor that understands the problem, and so they may think, let me let that person borrow my medication, why should I just hold on to that? And that has its own dangers as well. In fact, we probably a lot of these unintentional overdoses are related to people taking other people's medications, not their own.
I think you're probably so right. People keep these things in their medicine cabinets, and at times they're sort of brand names that you might actually be familiar with. They might be called Tylenol, or I don't know if that exists, but you know, something that you're familiar with, and people are like, well, I have a really strong migraine, why don't I just take this? It worked for my mom after her C-section.
Exactly, or even maybe their own medications that they've kept from the past. So maybe they got a medication for their surgery, and then now they have a different type of pain, and they think, well, it works so well for that, maybe it's safe for me to take it just this time for my new problem or my new chronic pain issue. In general, you know, we want people to have their pain treated, but the thing is, it's important to really have that discussion and know what you're taking the medication for and what the dangers are.
Right, perfect. Dr. Devi Thank you. Assistant Professor of Anesthesiology and Rehabilitation at NYU Medical School. Thanks for joining us.
Thank you.
Well, up next, we'll have a report from India where a brutal rape case is changing the way society views women. Plus, a spectacular show from Mother Nature. This is Up to the Minute.